in Maharashtra Government Hospital Nanded. I mean, we were covering about it earlier. The story was that 24 people died in span of just 24 hours. The dean came out and he said that whatever is happening, is devastating, but we cannot do anything about it because there is lack of medical staff, there is lack of medicines. We had to go to local stores to get medicine. We don't have proper supply for it. There are, a lot of vacant positions in the hospital. We don't have, enough staff to cater to the needs, because we are, we are the only hospital surrounded in, like, covering 30-40 kilometers of the district. So people come up from far off places as well, and we do not have the capacity. We just have 500-800 beds, and the admission that are being in the hospital they cross the mark of 1,000. So how are we going to deal with it? And they have asked government to give them the funding. The lack of funding, lack of medicine is the they are saying. But look at the visuals. I mean, people are devastated. You go to a hospital in the hope that you will come out alive, that the doctor will be able to save you, but something like this is happening, that 24 people died in 24 hours, and it just doesn't stop there. We have some latest coming in from the hospital horror in Maharashtra. It says that 7 more deaths reported in the Nanded Civic Hospital, and the death toll has now risen to 37. Adrika, 37 people died, in the hospital. I mean, and the reason they are providing is that there is lack of medical staff, there is lack of medicines, we cannot do about it, there is lack of funding. But how will you justify this, when a person from a family who just lost his family member just because the hospital was not able to cater his needs or her need, died? I mean, how are you going to justify it to them? It has also coming in that 7 deaths, and it's just not the Nanded hospital. I mean, something is going on with the Maharashtra government hospitals, and the government really needs to look into the matter, because we have 7 deaths in Mumbai's JJ hospital in the last 24 hours, 18 deaths in government hospital Chhatrapati Sambhaji Nagar, and the High Court has taken suo motu cognizance of the deaths. Lack of medicine and staff cannot be tolerated. The High Court has came out and said, because this is not just one hospital that we are talking about, 3 to 4 hospitals in Maharashtra government. I mean, how are these deaths happening? People go to the hospital in the plight that will get better, and then you go to a hospital and people are dying like this, like in 24 hours, 7 deaths, 24 deaths in 7 hours. In Nanded hospital, death toll has risen to 37 just because the hospital is not at the capacity to cater to them. I mean, how do you see this development, Adrika?
You know, what comes to my mind is Mumbai, and Maharashtra, they were one of the worst hit areas by the COVID. And what everyone took cognizance of was the fact that now bolstering the health infrastructure, bolstering our healthcare comes as first priority. Everything else, can be taken care of later. But if your healthcare infrastructure is not in place, if your population, if the civic amenities that are the bare minimum for each and every citizen, I mean, it's a right, Nancy. You know what the Hindustan Times is reporting for the Nanded case is that most of the patients, including infants who died, Nancy, in the government hospital in Maharashtra's Nanded district in a span of 2 days was suffering from multiple illnesses and were referred from private facilities in a critical condition. It revealed a preliminary inquiry into the matter that has triggered nationwide outrage as the death toll rose to 38 on Wednesday. What the Hindustan Times is reporting, that the death toll right now is 38. Meanwhile, Bombay High Court said the reasons given by doctors for deaths at the 2 state-run hospitals cannot be accepted, as it took suo motu cognizance of the matter. Exactly. I really want to thank the court for saying that this is not an acceptable reason. It's almost like just because the hospital, authorities felt a little bit of, that's what it looks to me, the little bit of guilt that they felt, they came out and they said, oh, we do not have the staff, we do not have the facilities. And when a hospital or when a healthcare institution is put in place, there cannot be excuses made along the lines that we do not have, we do not have the staff that can support the emergencies that we have, or then refer people to different hospitals, build a new hospital. I mean, it sounds very big for the both of us to sit in an AC room and talk about all of that, but people are dying, 38 people. the loss of manpower, 38 people is not a number to be joking around,
Definitely.
right? And after COVID, all of us should have realized that health comes first. That's the priority. We saw how the entire world collapsed when there was a health crisis, and if we still, again, the fact that we are recovering as a nation, and even the globe is recovering, and if we still have our health infrastructure in unaccepted debris of excuses like that, I don't know where we are going to take our future.
I mean, you
to.
can see how officials have gathered up in the Maharashtra hospital, and they are trying to get to the crux of the matter. Police is also there. But my question is that it's very evident that these deaths are not mere coincidences. This is happening because the hospital just failed, the authorities failed to cater to the needs of the people. And if you don't have the capacity to cater to the needs, or provide proper facilities to these patients, you should have raised it up with the government. You should have come out and you should have said that this is not something that is acceptable. We need to, we cannot afford people, because we are talking about losing lives here, and also of 12 infants. We are talking about infants, just who newborn babies. I mean, we are talking about how are you going to justify it? And the Bombay High Court on Wednesday took suo motu on its cognizance of its death at the state government run hospital at Nanded Hospital and Chhatrapati Sambhaji Nagar, and sought details from the Maharashtra government. A division bench of Chief Justice D.K. Upadhyay and Justice R.F. Doctor asked Advocate General Birendra Saraf, appearing for the state government, to submit to the bench details about the state's budgetary allocation for health on Friday. This, the Bombay High Court has come out and they are saying that how much funding are you giving to the health sector, because this is not something that is acceptable. Government hospital already have an image of something like that, and I mean, how are they, the government, obviously the government is to blame, obviously the authorities are to blame, that they were the ones who failed to provide funding to the hospital. And now after the deaths are happening, the dean is coming out, the hospital is coming out, and now they are saying that we don't have fundings, we don't have enough medical staff. I mean, what now the deaths have been reported, what was happening before that? I mean, it's not like suddenly a surge of people came in and now you are suddenly out of staff. I mean, the moment you thought that we are not being able to cater to the needs, you should have raised it up with the government, and the government should have also prioritized it.
Exactly. And firstly, there's no compensation for the lives lost. Nothing can compensate for human life loss, right? And what I really want to understand here is that it really took the death toll of what the Hindustan Times is reporting for now is 38, for the authorities to look into the budgetary allocation for Maharashtra into its healthcare infrastructure. Isn't that supposed to be a common practice when you realize that your healthcare infrastructure and the institutions are not in place? I think it should be a common practice for the authorities to look into the budgetary policies and look whether if the institutions kind of require a better influx of money and finances into the system. But it really took the death of 38 people, Nancy, for the government to realize the fact that something is wrong with our infrastructure, something has to be done with our system. So that really breaks my heart. I don't know how to process this information.
Yeah, definitely. I mean, whatever is happening is something that the government really needs to take action on. The government really needs to, held accountability for it, that whatever is happening is just not acceptable. We can wait and see that, the development, and the High Court has come out and they have asked the Maharashtra government to come out and give explanation to why is it happening and what will go on.